You jibber jab, bamboozle, nuka, noozle, bippity bop, she-gall. You jibber jab, bamboozle, nuka, noozle, bippity bop, she-gall. I mean, you keep on talking, but you don't know where to turn it off.
Good evening and welcome to the weekend. I'm John Caldera, president of the Independence Institute. You're watching Independent Thinking. So, you ready for your hospital bills to go up over 5% without your permission? Well, that's just what is happening with, is it House Bill 1293 or Senate Bill? House Bill 1293. We're going to get into this. Representative Greg Brophy, thank you for joining us. Now, you're from out in the plains somewhere. Anything past Aurora is just Kansas to me. So
well, I'm really close to Kansas. It's about 12 miles, but they moved me up to the Senate about 4 years ago.
Oh, good God. Sorry about that. I didn't vote for you.
I know.
Yeah.
But 72% of the district did, so we'll take it.
Really? But you were running against a pig or a cow or a...
Well, we call them Democrats where I live.
Stop it. All right, Linda Gorman from the Healthcare Center here at the Independence Institute. Thank you for joining us. All right, just so you know about this, I want to let you know that we tried to get the authors of this bill to come out and talk about that. It included Representative Reesburg and Ferrandino. We also talked to Mo Keller. They wouldn't come. Let me just go down the list of the folks who supported this. Laura Bradford wouldn't come. Don Morostico, these are two Republicans who support this bill. Betty Boyd wouldn't come. Patty Gabo from Denver Health wouldn't come. No response from Tom Massey, who's a Republican who voted for it in the House. Decline from the Executive Director for Colorado Consumer Health Initiative, Denise Person. So we tried to get the people who wanted to add 5% to your hospital stays here, but they wouldn't come. Now, most of these are your colleagues. Is it just that you've got more time on your hands, or what's the deal?
Well, maybe they just didn't want to come and face the music, because there's some hard questions to answer about why you want to vote for a bill like this. 5% increase in your hospital bill, seeking a half a billion dollars a year in federal matching dollars, when the federal government's running a $1.3 trillion deficit this year, and $1 trillion deficits going into the future as far as the eye can see, and the certain representatives in Colorado and senators voted to ask for more money from the federal government on top of raising your hospital fee.
All without a vote of the people, which apparently is just hunky-dory with the Colorado Supreme Court. But we'll get into that in for a second. Lay the foundation for this. Here in Colorado, there are a lot of people who get assistance for hospital stays, including people on Medicare. Those are the elderly. And then you have children, and that's through, was it SCHIP, which stands for?
State Children's Health Insurance Program. It's a federal program. If the state spends $1, the feds match it with $2.
And this is so basically health care for kids. The state of Colorado spends $1, they will chip in $2.
Right, and here it's called the Colorado Children's Health Plan.
Nice deal until you realize that we're also paying federal taxes.
Yes.
And the other part is, of course, Medicaid, and that is a state-run program, but it's also funded by the feds. How does that work?
For $1 spent on Medicaid, the feds pay an extra $1. So in the early 90s, states realized that, well, gee, they have a lot of government-owned hospitals. So instead of charging $100 for a hospital visit and getting $100 from the Fed, they would just artificially inflate the price to $200 for a hospital visit. So they get $200 from the feds. We all know that hospital bills have nothing to do with actual costs. The states took the money and went merrily home and said, ooh, look at the increase in our state budget. Well, the feds caught on to this. These are called provider taxes, and they now limit the provider tax that can be applied to 5.5%, and you have to uniformly apply them. So Colorado's finally getting on this bandwagon, except here it's a provider fee, not a provider tax. The rest of the world, including the feds, call it a tax. But we have Tabor, so it's a fee. So soon we'll have sales transaction fees and personal income fees as opposed to taxes.
And I want to get that straight for people who don't know this part, and this is crucial, given what I think is just one of the most partisan decisions handed down from the Supreme Court here in Colorado, and that says a lot. They said the mill levy rate freeze was not a tax increase, therefore it didn't have to go to a vote of the people. With that, the legislature and the governor have now signed a car registration tax increase. They call it a fee. That way they don't have to ask us for permission. They did the same thing. I'm trying to remember with what other things they've done. But fee increases have been all the rage right now. All because if you call it a fee, you don't have to follow the constitutional mandate to ask voter approval. Do I understand this correctly?
You nailed it, and they've feed or taxed marriage, waste, tires, now this hospital tax. We're talking about now over $1 billion a year in new taxes masquerading as fees.
All right. But when it comes to this, when it comes to Medicare, or excuse me, Medicaid, other states and the federal government calls these what we call fees, they call them taxes. Is that right?
This is called a provider tax, yes.
All right, but if they use that word provider tax the same way they do it in other 40 some odd states, if they did that here, this would mean that this House Bill 1293 would have to go to a vote of the people.
You'd have to ask everybody whether they want to impose an up to a 5.5% tax on the bills of people who are buying hospital services. This isn't a tax on hospitals. This is a tax on hospital revenues only from patients. It's not a tax on government grants that hospitals get or what they sell in their gift shop. It's just a tax on patient revenues, inpatient and outpatient. And they have to keep it secret. In the legislation, there's a line that says that no hospital may break this out separately on the bill. So they know they're doing wrong.
I want to jump on this one first. Before we get into the shell game of the money, which is really pretty fabulous, you're going to love this. Let's just talk about the transparency. As you know, at Independence, we've been working toward to get more transparency in government, try to get check registers of the government online. And in fact, the governor has put together an executive order, and he is trumpeting transparency so we know what's going on in government. The state treasurer has been pushing for a website to show us transparency, but this law itself says you, hospitals, you're going to charge everybody 5 point whatever more percent more, but you can't break it out on a line item and make it transparent. Do I get this part right as well?
You got that part right. And we tried to amend the bill to take that part out and make them show where the fee tax is coming in, and they refused to allow us to do that.
They being?
They being primarily the majority party, the supporters of the bill.
Of which none wanted to come here and talk about that, including a lot of the organizations that supported this as well. Yeah. So in this great lip service age of transparency, House Bill 1293 has none.
No transparency.
I love that.
It gets worse because they set up this watchdog advisory committee that's going to be mostly controlled by the hospitals to decide which hospital should get what money and which hospital should be taxed and which hospital shouldn't be feed or taxed. I'm going to call it a tax from now on, that's what it is. And they decide whether hospitals are padding their costs by asking the hospitals to submit documents that they look over, but the documents aren't part of the public record.
Excuse me?
Correct. I mean, they're secret too.
So the hospitals hand over documents to
make sure they're not padding their costs, because this bill says that they have to reimburse hospitals at cost. Nobody else in healthcare gets reimbursed at cost, but the hospitals have to be reimbursed at cost now because of this bill.
But we're not allowed to
But we don't know what their costs are.
Those costs.
And these are the guys who have been charging people, you know, who are uninsured outrageous amounts of cash money, and we're supposed to trust that they're going to give us a fair accounting of their costs.
All right. Now this has, of course, a nice, warm, friendly title. They always do. This is, what's it called? The Affordability Act? Healthcare
Yes.
Affordability Act. By raising it 5%, it's going to be more affordable. Orwell would love this. All right. Explain to me what happens. A few years ago, my appendix decided to burst. It was a wonderful experience. Week in a hospital, bilateral pneumonia. It was just what every guy wants. So that happens now, after the governor signs this into law, and of course he will. What happens? What happens? I am charged another 5 point whatever % on my bill, and I don't know it.
You won't know it. The hospital is charged with raising up to $26 million a year for a larger hospital. It's going to be broken down by hospital size, but bottom line is the hospitals have to figure out how to come up with between $200,000 a year if you're a small hospital and multiple millions a year if you're a larger hospital, so that you can turn that money over to the state to get the federal reimbursement and get paid back. So they have to raise the money somehow. There's only one way for a hospital to raise money: charge people more. And so you can look for your bill to go up at the hospital by about 5.5%.